Question 1. A nasal cannula can be used to deliver oxygen at 1 to 6 liters per minute. What is the amount of oxygen delivered, FiO2, at 2 liters per minute? C. 28%. Room air is 21% oxygen. Every increase of 1 liter per minute, LPM, equates to a 4% increase in fraction of inspired oxygen, FiO2, starting from 24%. FiO2 via nasal cannula, 1 liter per minute, 24%. 2 liters per minute, 28%. 3 liters per minute, 32%. 4 liters per minute, 36%. 5 liters per minute, 40%. 6 liters per minute, 44%. Question 2. A 41-year-old female is transported to the emergency department with burns on her entire legs and her perineal area. The nurse quickly calculates that space of the client's body has been burned. C. 37%. The fastest method of calculating the area of burns for an adult is the rule of nines. Each entire leg is 18%, each arm is 9%, the trunk is 36%, and the perineum is 1%. For this client, the total is 37%. Question 3. A 28-year-old female comes to the OB clinic after getting a positive result from an at-home pregnancy test. She tells the nurse that her last menstrual period began on February 2nd. Using Naegele's rule, the nurse calculates that the client's estimated date of delivery, EDD, will be C. November 9th. According to Naegele's rule, the estimated date of delivery, EDD, is calculated by adding 7 days to the first day of the normal menstrual period, February 2nd plus 7 days equals February 9th, and then counting back 3 months. February 9th to 3rd months equals November 9th, the other dates are incorrect. Note, EDD replaces the former term, estimated date of confinement, EDC. Question 4. Following a patient's myocardial infarction, the nurse assesses the patient's electrocardiogram strip shown in the image. The nurse identifies the rhythm as C. Sinus tachycardia. Sinus tachycardia is a rate over 100 bpm. The conduction and rhythm are normal. The P wave precedes the QRS complex, which is usually normal. Following a myocardial infarction, sinus tachycardia should be quickly assessed and treated. Question 5. The nurse working in a cardiac clinic is taking the medical history of a new client. All of the following are indications that the client has hypertension except B. Lower extremity edema. Although hypertension is called the silent killer, there are some early symptoms that do occur in some clients, including early morning or persistent headaches, nosebleeds, vision changes, flushed skin color, heart palpitations, lightheadedness, fainting, and buzzing in the ears. Severe hypertension symptoms include fatigue, nausea, vomiting, confusion, anxiety, chest pain, and muscle tremors. Lower extremity edema is indicative of heart failure. Question 6. A new client tells the nurse that her previous provider told her she has endometriosis, but the client doesn't understand what that means. How should the nurse explain it to the client? A. It's when tissue that normally lines the uterus grows in other places. Endometriosis is the presence of endometrial tissue outside of the uterus, often around the fallopian tubes and ovaries and in the pelvis. Pelvic inflammatory disease, PID, is an infection, sometimes caused by sexually transmitted infections. Endometriosis does not increase the risk of ovarian or other cancer. The pain that occurs in the middle of the menstrual cycle is called Mittelschmerz. Question 7. During a routine visit to the internal medicine clinic, a client tells the nurse that despite having little appetite, the client has gained 6 pounds, 2.7 kilograms, during the past week. When performing a physical assessment, the nurse notes that the client has edema in the feet and ankles. Which of the following conditions is most likely to be the cause? A. Congestive heart failure. The client's unexplained rapid weight gain is probably due to fluid retention. According to the American Heart Association, a weight gain of more than 2 to 3 pounds, over 24 hours or 5 pounds in a week could be a sign of heart failure. A lack of appetite or a sensation of being full is also a sign of worsening heart failure. Other signs and symptoms are fatigue, weakness, dyspnea, persistent cough with blood-tinged phlegm, and difficulty concentrating. Hyperthyroidism, not hypothyroidism, can lead to low body temperature, which causes fluid retention or bloating. Cushing syndrome can cause weight gain, usually seen in the abdomen, neck, face, and upper back. Marfan syndrome is a connective tissue disorder, characterized by unusually long limbs. Question 8. A client with a new diagnosis of type 2 diabetes asks the nurse about the difference between type 1 and type 2 diabetes. All of the following statements about type 2 diabetes are true except B. Management of type 2 diabetes can only be done with insulin shots. Type 2 diabetes results when the pancreas does not produce enough insulin and the insulin doesn't function properly. Management includes medication, insulin may or may not be necessary, and lifestyle changes. Type 2 diabetes typically happens in midlife or later. Risk factors include overweight, obesity, lack of exercise, hypertension, and a family history. With proper management and active changes, type 2 diabetes can be prevented or put into remission. Signs and symptoms of type 2 diabetes can develop slowly, especially in early stages, and be difficult to recognize. Question 9. Following application of a short leg cast for a fractured ankle, which discharge instruction by the nurse is correct? C. Use pillows to elevate the cast above your heart for 24 hours. Elevating the leg is the best discharge instruction. Decreasing edema, which can lead to compartment syndrome, is the priority after a cast is applied. Cutting the cast can cause fragments to fall into the cast and cause skin irritation. Instead, clients should be instructed to petal the edges. Walking or weight bearing is usually not permitted until a follow-up visit. Burning and tingling are abnormal signs, indicating nerve damage or ischemia. Question 10. When the nurse observes an isolated premature ventricular contraction, PVC, on a patient's cardiac monitor, which action by the nurse is most appropriate? C. Continue watching the client's rhythm. The nurse should continue to monitor the client's rhythm. PVCs are relatively common. Up to 80% of people without heart disease will have at least one PVC during a 24-hour Holter monitor study. At this point, without other information available, no other actions are indicated. Question 11. The nurse in an outpatient surgery center is providing post-operative care for a client who had a laparoscopic cholecystectomy. When the nurse assesses the client in the recovery room, which findings should the nurse report to the surgeon? C. The client has pain in the upper right quadrant. For treatment of symptomatic gallbladder disease in the United States, the procedure of choice is laparoscopic cholecystectomy, a minimally invasive procedure. And NBSB. Bile leaks are a rare but serious complication of gallbladder surgery. If a bile duct is damaged during surgery, bile may leak into the abdominal cavity, causing extreme pain. Bile leaks are often corrected by placing a stent, narrow tube, into the duct to keep bile from escaping while the duct heals. Shoulder pain or discomfort is a common complaint following laparoscopic surgery, caused by the effects of carbon dioxide gas used during the procedure. A patient who is drowsy from anesthesia may not want to take fluids. A lack of bowel sounds after surgery is not a concern. Question 12. A client with a recent insertion of a permanent pacemaker arrives at the clinic for a follow-up appointment. Which statement by the client demonstrates an understanding of self-care? C. I must take my pulse every day and keep a log. Clients with a pacemaker must be able to measure their pulse in their wrist or neck and record it to note any variations. Signs and symptoms of pacemaker malfunction or failure include dizziness, lightheadedness, fainting, palpitations, dyspnea, tachycardia or bradycardia or a combination of both, and frequent hiccups. Current airport security body scanners don't interfere with pacemakers or implantable cardioverter defibrillators. Vigorous exercise, especially with the arms and shoulders, should be avoided for 6 weeks after insertion of the permanent pacemaker. Question 13. A mother takes her 11-year-old daughter to the clinic. She is concerned because the girl is always tired and thirsty. The girl has a good appetite but is losing weight, and she has started urinating frequently. Which laboratory assessments can the nurse anticipate? A. Serum glucose and A1C. The daughter is displaying signs and symptoms of type 1 diabetes, T1D, and will require measurements of serum glucose and A1C levels. The most common and NBSB symptoms and NBSB of and NBSB, T1D are and NBSB, polyuria and NBSB, polydipsia and polyphagia, along with fatigue, nausea, and blurred vision. All are related to hyperglycemia. And NBSB, polyuria and NBSB, is and NBSB, caused and NBSB, by osmotic diuresis secondary to hyperglycemia. The other assessments are not indicated. Question 14. Which of the following ECG changes indicate a positive myocardial stress test result? C. Depression of ST segment. Depression of the ST segment is often an NBSB, sign of myocardial ischemia and coronary artery disease. Tenting of T waves is related to hyperkalemia. Prolonged PR intervals are indicative of first-degree AV block. Pathologic Q waves are a sign of previous myocardial infarction. Question 15. The oncology nurse is educating a client who will start to receive radiation treatments for a mediastinal tumor. Which statement by the client indicates an understanding of how to manage side effects of the radiation therapy? C. I'll avoid getting tanned or sunburned for the rest of my life. Radiation can cause mucositis and esophagitis, resulting in inflammation, pain, mouth sores, and difficulty swallowing. Clients receiving radiation therapy should avoid citrus fruits, spicy foods, caffeine, and alcohol. They should be encouraged to use a humidifier when sleeping. Using 1 or 2 pillows to elevate the upper body can provide additional comfort. Because their skin has been damaged, clients must avoid the sun and wear sunscreen during treatment and for the rest of their lives. Clients should not apply alcohol to the irradiated area. Question 16. When a client has received an intestinal transplant from an organ donor, what is an early sign of graft rejection? A. Change in fecal output. Graft rejection is not always specific, but of these options, the most accurate sign is a change in fecal output. There are no specific lab values to indicate rejection of the graft. Recipients may develop fever, vomiting, or abdominal pain. Bowel sounds may be absent as graft rejection progresses. Question 17. The nurse is caring for a client with end-stage renal disease, ESRD, who is being treated with peritoneal dialysis. Which of the following is the most important information for the nurse to report to the healthcare provider, HCP? B. Increased body temperature. The nurse should report the elevated temperature, because it indicates an infection. Clear, yellow dialysate, reduced serum creatinine, and output greater than intake are all normal findings. Peritoneal dialysis accomplishes the removal of waste and excess fluid by using the abdominal lining, called the peritoneal membrane, as a filter. Fluids and dissolved substances, electrolytes, urea and NBSB, glucose, albumin and other small molecules, are exchanged from the blood through the peritoneal membrane. Question 18. A wife drives her husband to the emergency department because he complained of terrible heartburn. He tells the nurse that he also has crushing chest pain with more discomfort in his left arm. The nurse knows that his symptoms are likely consistent with which diagnosis? A. Myocardial infarction. Use the mnemonic pulse equals persistent chest pain, upset stomach, nausea, vomiting, lightheadedness, dizziness, shortness of breath, excessive sweating. The classic signs and symptoms of myocardial infarction include a feeling of indigestion or heartburn, a crushing pressure or pain in the chest, pain extending down the left arm, shortness of breath, nausea, and a cold sweat. Chest pain with gastroesophageal reflux is more of a burning sensation. Cardiac tamponade is a life-threatening emergency, characterized by bulging neck veins and muffled heart sounds. Gastrointestinal bleed does not usually present with chest pain, although shortness of breath may be noted. Question 19. The nurse does an assessment of a 20-year-old female client who is suspected of having Mittelschmerz. Questioning the client, the nurse expects to hear the client report. C. I get sharp pains in the middle of the month. Mittelschmerz is one-sided, lower abdominal pain associated with ovulation. Mittelschmerz occurs midway through the menstrual cycle. During ovulation, the egg, follicular fluid, and some blood are released from the ovary. The pain is sharp and felt on the side where the ovulation occurred. Slight vaginal bleeding may also be present. Question 20. A provider has ordered hyperbaric oxygen therapy, HBOT, for a diabetic client with a chronic non-healing wound. During the therapy, what is the nurse's priority? B. Ensure that adequate oxygen is being delivered. Hyperbaric and NBSB, oxygen therapy and NBSB winking sad smiley HBOT, is a treatment designed to increase the supply of oxygen to wounds that are not responding to other treatments. And NBSB, one characteristic of chronic wounds is that the tissue is hypoxic. The nurse's priority is to ensure that oxygen is being delivered throughout the treatment. Other actions are appropriate but not the priority. Question 21. Following a total hip replacement, what is the appropriate position for the client? A. Abduct the hip. The client's hip is maintained in an abduction position, which is away from the midline. Adduction is positioned toward the midline. Extension is keeping a body part straight, and flexion is bent. To prevent the client's prosthetic femoral head from becoming dislodged, a triangular foam wedge is usually kept between the client's legs while the person is in bed. Question 22. The nurse is preparing a presentation on the uses and benefits of occlusive dressings in wound care. All of the following statements about occlusive dressings are correct except B. Occlusive dressings are effective against pre-existing infections. Occlusive dressings are used for sealing particular types of wounds and their surrounding tissue off from air, fluids, and harmful contaminants, such as viruses and bacteria, in a trauma or first aid situation. Moist condition makes wound healing faster, relieves pain, prevents infection and contamination than acute wound treated with other methods. Pressure and bleeding can be managed immediately with occlusive dressings. Traumatic injuries, such as pneumothorax and evisceration, can be temporarily managed. Wound maintenance can be achieved by combining an occlusive dressing with a gauze or sponge, which can be soaked in a medicine such as antibiotics. Occlusive dressings should not be used if there is a pre-existing infection. Question 23. As part of routine neonatal screening, parents learn that their newborn has tested positive for cystic fibrosis, CF. Which of the following signs of CF will be among the first to appear in the infant? B. Salty skin. Cystic fibrosis, CF, is an inherited disorder that causes severe damage to the lungs, digestive system and other organs in the body. CF causes mucus, sweat and digestive enzymes to produce thick, sticky secretions that cause obstructions, especially in the lungs and pancreas. All 50 states and the District of Columbia screen newborns for CF. Babies born with CF often show symptoms in the first year. Besides salty skin, other signs are coughing, wheezing, frequent lung infections, excess mucus, slow growth, even with a good appetite, stomach pains, and bowel movements that are frequent, loose, and greasy. Question 24. The nurse reviews the daily lab results for a patient with a serious bacterial infection. When reporting the WBC differential to the patient's physician, the physician notes, "There's been a shift to the left." The nurse knows this means B. The infection is still progressing. Shift to the left means that there is a shift in the WBC towards more immature neutrophil cells, more bands and blasts. This shift is present in most bacterial infections. In the event of a bacterial infection, large numbers of neutrophils migrate from the blood to the infected site to destroy the invading microorganisms and thus protect the host. Shift to the right means that there has been a shift back to the normal differential. Question 25. Knowing that a client undergoing head and neck radiation will likely develop stomatitis, which daily routine measure should the nurse include in client teaching? B. A weak saltwater solution can soothe the mouth. Stomatitis, or oral mucositis, is the inflammation, irritation, or ulceration of the mouth and lips. It is a common side effect of head and neck radiation and chemotherapy. To soothe the tissues and provide gentle cleansing, the client should swish and spit with a weak saline and water solution before and after meals and as needed. Clients should avoid hot beverages and foods that are salty, spicy, or citrus-based. Fruits and vegetables provide vitamins and nutrients for healing and preventing infections. Alcohol can increase dryness and should also be avoided. Using a straw can keep liquids away from sore areas of the mouth. Pain relievers such as acetaminophen or ibuprofen may be helpful. Subscribe our channel and stay connected for part 2.